if I'm going to hire a medical director, I'm going to hire them because only for reasonable services that I require them to do. I will not hire more than one medical director, unless of course it is needed where you have those thousands of patients where you need to be able to have that you have more than one. Now, the next thing is this. Do not hire that medical director because for the sole purpose, for the main purpose of getting referrals, okay? Do not hire them or hire them only if you have looked at their qualifications, if they're actually qualified to become a medical director. Just because they are a physician, just because they have a license, that does not mean they are qualified to become a medical director. Never, ever, ever, ever pay more than fair market value for that services of a medical director should provide you. You want to be able to carefully document the services that he or she has provided. Make sure that it is documented, it is written, it is videotape if needed. Whatever you need to do, make sure that it is documented that they are actually doing what they're supposed to be doing under the policy and procedures, under the job descriptions of that medical director. Every year, evaluate. You do this for your employees. Your medical director is your employee. If you're scared to evaluate this physician, this medical director, then don't hire them. Because they work for you. Just because that they have a higher license, a higher degree, just because they've had more education, they still are an employee of your organization and agency. When those doctors, the medical directors, are contributing to you, I want to be able to give you some examples of what medical directors can accomplish and help with your home health agency. They need to be acting as a liaison between your staff, your team, and other physicians that are referring to your agency. Sometimes for people to be able to speak to someone in their level, there is going to be more respect among each other and understanding, and things can be carried out better. At the same time, the medical directors should be coaches. They should be leading your team. They're part of the management organization. They can help answer questions that you may not have. They can speak to your registered nurses when you're having in-services. They can help navigate and give you more patient information, more clarification on the care of a particular patient. Also, when these medical directors are working for you, you should have timesheets for them, because your staff does not get paid unless they turn in their timesheets. Same thing for your medical directors. They should get paid what they put in. So, make sure that they turn in their time slips, especially if they're being paid per hour. Now, some physicians out there who are medical directors are given a standard salary. So if that is the case, they still need to show and turn in what they have done for that week or for that month. Are you just going to pay your nurse even if they're not visiting patients? No. These people, these medical directors are your employees, and if they don't put in the time, they don't get paid. Okay? It's that simple. So look, medical directors are required nowadays in most states. So what I want you guys to understand is having a medical director for your agency is vital also, and it's a very good thing to have. Now look, you want to be able to qualify them. Like I said in the beginning of this video series, you want to be able to make sure that they are able to be a medical director. They have experience, or they are able to tell you what their plans are and how they're going to be able to relate and help your staff and help your team. Medical directors are great sources of information as long as you have the right type of medical director. And so I really want to make sure that when you do hire one, you make sure that you monitor them as well. Make sure that they do put in the time for the salary that you're giving them. And also understand, once again, you are not putting in or hiring a medical director for the sole purpose of you being able to get referrals. As a matter of fact, when you do have a medical director, you should stay away from needing to be able to admit any of his patients in your agency. Look, he may have a referrals. Yes, you can admit certain amount of them, depending on what is needed. But look, have him help you become a good direct point for you, a good power player or power partner, as we may say. Have him help you introduce you and your agency to another physician that he knows. Okay, look, it's good to be able to network, but when you have a medical director, his sole job in your agency is to become a support under management, to be able to give directions for your clinical staff, give them education, be able to be that person as a go-between between your company and current physicians that are referring to your agency. Medical directors are a great thing to have. Make sure that you know and you meet the right ones and hire them as needed and as correctly, and you make sure you screen them.